Hi, my name is Brenda Schwarzbach. Today we're going to be doing the basic Swedish massage for the lower body. Your client should be lying on the table, fully draped. We're going to be uncovering their left leg first. And so what you'll do is you'll go ahead and then uncover the leg. Then you'll make sure that it's tucked tightly underneath the leg and then also up above the hip so that the trochanter is actually exposed. The trochanter is the widest part of the person's hip, and that's where a lot of the different large muscles are attached. So you want to make sure that that's exposed so you can get to it. There's going to be some long motions that you will do up and down the whole leg in order to put the oil on. And then you're going to be doing some petrissage or some kneading motions to the top of the leg and then to the side of the leg. When you do your petrissage or kneading motions, make sure that you're actually picking up the tissue, that you're moving that muscle, that you're moving that fascia. Don't be shy. Just go ahead and then get into that muscle a little bit. Your client will love you for it. So I usually spend a little bit of time on the upper leg. The quadricep muscles, those big heavy muscles in the front of the leg, are really important, but also that iliotibial tract, that IT band that's on the lateral side of the leg, along with that large hamstring muscle called vastus lateralis. Those are real important muscles to be able to do that kneading motion to. Also, the inside of the leg can be very tender. Usually when I work on the inside of the leg, I'm almost working underneath it at the same time. Rather than having your fingers point up to the groin area, make sure that your fingers are actually pointed down toward the table, or turn your body a little bit so that your fingers are actually pointed toward their knee so that they don't get worried that you're going to be touching anything that you're not supposed to be. So a lot of the times when I'm working on the inside of the leg, I'm actually under the leg instead. A lot of my transitions are also going to go from the upper leg to the lower leg before I actually get to the lower leg itself. But also I'm going to work on those tendons and the attachments around the knee. Usually these feel really good. Remember that your knee is connected by muscles both below it and above it. And so working on those attachments around the knee can help people with knee issues that are actually caused by tight or imbalanced muscles. After you work on the knee a little bit, then you are going to be working on the calf. The calf doesn't really have much muscle in the front. You will be doing some kneading motions there, but most of your work on the calf muscle itself is going to be when your fingers are underneath. So when you're working on the front part of the lower leg, you're going to be working on tibialis anterior. And then when you are working on the rear part of the leg, when your fingers are underneath, you can work on the gastrocnemius. And if the person is small like this gal was, could probably work a little bit on the soleus as well. But gastrocnemius is one of those muscles that's, of course, attached to your Achilles tendon. So this muscle gets a lot of attention, especially for women who wear high heels like Regina did. Later on, we're actually going to add a stretch for Regina's calf because her muscle was so tight. But we'll do that when she's lying on her stomach. Now I'm working on her foot, working on the tendons, not only working with the tendons on the top of the foot, but also trying to spread the bones apart underneath the foot. And then we're going to be working on the toes as well. People absolutely love to have their feet worked on. And for some folks, you can spend a lot of time here. So I'm working not only with the bones on the top of the foot, but also using my thumb fairly deeply underneath on the plantar surface of her foot. And then I'm going to work a little bit on each of her toes as well. Just spend a little bit of extra time with the person's foot. Again, when the person is lying on their stomach, we'll probably do a little bit more work for there also. A lot of our clients spend a lot of their day on their feet, so this is one place that you don't want to skimp on. Now we're going to be doing some digital friction to each of the toes, gliding between each of the toes, just making it a nice flowing movement from one part of the foot to the next, rather than just dropping the toe and letting it go and then grabbing it again. We're going to do a little bit of a twisting motion to their foot, loosening up those metatarsals. Then we're going to do the twist to the lower leg, working our way up. Skip past the knee, you don't have to twist that part. Then making sure that you're really lifting that tissue, really getting into the twist of the thigh. Here we've changed angles a little bit so you can see it a little bit better. Making sure that you're picking that tissue up, gliding all the way up to the top of the leg, and then back down to the foot again. Now we're going to get ready to finish this part of the body, kind of like signaling to the person that we're finished. We're going to take some nice slow movements up to the top of the leg, one nice long gliding motion down to the foot, and then we're just going to go ahead and gently cover it up. Now I'm going to give you a little bit of time to go ahead and then walk around the table, and we are going to go ahead and then undrape the next leg. So you should have your sheet again tight underneath the leg, and then also up above the trochanter. Make your long motions down the leg, and then back up, making sure that you've got the whole leg covered with oil before you start your next motions. So your petrissage to the outside of the leg, your petrissage or kneading motions, I guess I should call it, to the top of the leg where the rectus femoris is, those big quadricep muscles. And then you're going to reach gently on the inside, doing some sliding motions here to the inside of the leg as well. These are where the adductors are. Making sure that your fingers are not digging into the muscle, also being careful of the places where the nerves are on the very medial side of the leg. Gentle gliding motions over the top of the inside of the leg. And then transition again to the outside of the leg and do the petrissage motions a few times just to make sure that you've loosened up all of the muscle of the upper thigh. You'll be able to do this part of the body a couple of times, just checking for extra tension, remembering a place that maybe you'll want to go back to later on. Transitioning from the upper leg, pulling through the muscles of the hamstrings as you work your way down to the knee. Spend a little bit of time on the knee area, loosening up those attachments, both in front of and in back of the knee. That space right behind the knee, the popliteal space, isn't anywhere that you're going to want to work deep. So just work mostly along the sides, and then make sure that you spend some time with those calf muscles so that it's not adding extra pressure to that knee joint. So the gliding motions, the transition motions from the thigh to the calf kind of help the client to think that their body is actually all one thing rather than just a sum of parts. We will be spending some more time on the back of the calf shortly after the person is lying on their stomach. Right now I'm not spending a whole lot of time there, but I am going to spend a little bit more time on this particular foot. You can see how high her arch is, and I'm going to be using some different movements underneath the bottom of her foot, both with my fingers and then my knuckles, in order to loosen up some of the plantar fascia on this side. This foot was just really tight, so I used some different massage movements on this side than I did on the other one. That's something that you're just going to get used to doing because the body isn't equal on one side and the same on the other. So we're working a little bit now on the plantar fascia, also on the toes, trying to get a little bit of movement in these toes. And then we're going to be working underneath the foot. Again, I'm holding her ankle fairly tight so I can work on this area and stretch it without her leg just kind of like flopping around. So I'm supporting the back of her ankle while I'm pushing underneath her foot in order to stretch some of that. Now this is the twist. We did this a little bit earlier. Do the twist on the foot, and then you're going to go ahead and twist those big calf muscles. Again, skip over the knee and making sure that you get into those muscles, getting some nice movement around the fascia, through the adductors, over the top of the quadriceps, underneath the hamstrings, then down to the gastrocnemius, and then all the way down to the tarsals, the ankle, and then the foot as well. I'd like you to go ahead and do that long movement up the leg and then a light movement down. Cover this leg up, and then you're going to get your client ready to turn over, and so you'll be able to do the legs on the posterior side. So go ahead. So your client should be comfortable on the table, face cradle is adjusted, and then we're going to undrape their leg, making sure that the sheet is tight underneath the leg. And then also we are going to be exposing the glutes and the greater trochanter, so you'll be able to work on all of those big muscles on the posterior side of the leg. Long strokes from thigh to ankle and foot in order to put the oil on. And then you're going to be gliding through those big upper muscles using your kneading motions on the outside of the leg. You can see here I'm actually using my fist to glide through the gluteus maximus up through the pelvis area. Sliding forward toward ASIS, and then doing the kneading motions through the hamstrings and the adductors. Always make sure that you're moving the tissue, you're not just gliding over the skin. Grab that muscle, pick it up, and get it to change. It's a little less invasive to actually work on the adductors when the person is lying on their stomach. So take advantage of that. Gliding motions from the calf to the thigh, so we're transitioning, connecting the body together, and then doing some deeper movements through that gastrocnemius. Long movements using hands, forearms. And then we're going to flex the knee and we're going to work a little bit deeper on those calf muscles as I had talked about earlier. You can see the Achilles tendon here where that muscle is attached. She does have a little bit of a bruise. That is fine to work on. It's already turning green. It's not like it's going to be sore or something that I have to be careful for. So I went ahead and then did also some pin and stretch type motions, flexing the ankle as I'm gliding through the gastrocnemius in order to stretch some of that tight calf muscle. Gliding motion, transition to the thigh, gliding through the back of the leg. And now we're going to be working a little bit more on her foot with the plantar fascia. Making sure to hold and support the ankle while you're doing the deeper motions on the bottom of the foot. Gliding motions, working a little bit on the toes, sort of like spreading some of those metatarsals apart. You can see the angle of the arch that she has. Not all clients' feet are going to look like that. All right, twisting motion, a little bit more. It's a little bit awkward to do the twisting motion on the foot in this position, but it's really nice to be able to go through the calf and through those big thigh muscles with the twist. If you feel like you need to do it more than once, you can. Your client's not going to complain, that's for sure. This is a pin and stretch movement for the thigh muscles. Flexing the knee and then taking a big deep glide, pressing into the tissue as you stretch the hamstrings. It's a little bit more of an advanced move, but it's easy enough for people that are just beginning also. Sort of like a little bonus for you. Right, now we did the long stretch. We did the nice glide, and we've finished with the back of the leg. You're going to move around to the other side, undrape the other leg, make sure that it's tucked underneath the leg, and then take the sheet up high, and you can tuck it like underneath the waist, just making sure that that area around the greater trochanter and the glutes are exposed. We're going to be working on those as well. Nice long gliding motions, putting the oil on, and then coming up to the thigh to do the kneading motions, both on the lateral side, the posterior side, and then also on the medial side. This is an opportunity to work with the glutes, those long stripping motions through the muscles, kind of trying to smooth things out, taking things up to the top of the pelvis. Later on, you'll learn how to do stretches for this area also, but we're not going to show that today. Nice deep motions though. This area of the body is really important to be able to loosen up, especially for people that have lower back pain, so don't skip on it. Nice kneading motions to the thigh. We're going to spend some time. Always connecting the body, always doing the transition movements from one part of the body to the other, so your client has a feeling that everything is connected. Deeper movements to the calf, gliding gently past the popliteal space, but never any deep movements there. Working with the attachments on the medial and lateral side of the knee, and then including the gastrocnemius and the soleus into the movements on the calf. Always picking up the tissue, moving the fascia. So now before we do the foot, we're actually going to do some of the deeper movements on this calf using digital friction. Trying to slip into the side there where the soleus is. But mostly what we're doing is we're grabbing that big gastrocnemius muscle. a little bit of a pin and stretch. So plantar flex the foot and then dorsiflex as you're sliding through those muscles, trying to stretch and loosen things up. Next, we're going to spend a little bit of time connecting the body before we get down to the foot. And then spending a little bit of extra time with the plantar fascia on this side also. You can see the deep stripping motions with the thumbs can be kind of hard on your hands, so using your knuckles can be a little bit easier. One of the things you have to be a little bit careful for, though, is sometimes it's a little bit ticklish. So the more surface area that you can use on the bottoms of some people's feet, the less ticklish that they will be. So you'll just have to check to see what works best. Working a little bit with the toes, stretching the fascia around these toes. And then working on the bottom of the foot and then back up to the calf a few times. Twist through the calf muscles, past the knee, up through the thigh, and then working your way back down again. Always lifting the tissue and making sure that you're affecting change. Long stroke up to the top of the glutes, light stroke down to the foot, and then you're ready to cover them up. So good job. Thank you for joining me today. My name is Brenda Schwarzbach. I've been doing massage and teaching since 2000, and I hope you will join me for the next section of the video as we complete the body when we do the back. We'll see you soon.